Now to the fight over fluoride in our drinking water. U.S. Health Secretary Robert F. Kennedy Jr. says that he plans to tell the Centers for Disease Control and Prevention to stop recommending fluoridation in communities nationwide.
Kennedy says that he's assembling a task force of health experts to study the issue and make new recommendations. Also, the U.S. Environmental Protection Agency announced that it's going to be reviewing new scientific information on potential health risks of fluoride in your drinking water.
All right, so you're sitting at home like we're sitting here going, what's wrong with it? It's been in my water forever.
Right?
Is that a problem? What do I do? Is there reason to be concerned? Joining us now is ABC News medical correspondent Dr. Darien Sutton. So, Dr. Sutton, truly, I mean, now all of a sudden they throw me this thing about we should take fluoride out of the water. And should I be worried?
Yeah, you know, you should not be worried, just to take a step back and understand where all this information is coming from.
Okay.
So fluoride is a naturally occurring mineral. It's responsible, or the water that we drink, about 70% of the population has fluoride in it. That's about 200 million people. Yeah. Now, there have been prior studies that have shown that high levels of fluoride have been associated with developmental delay and lower IQ in children, and that is incredibly concerning, but context is so important. These studies were done outside the United States at levels twice the recommended limit here in the United States. And so it reminds us that something is possibly helpful at one dose, but harmful at another.
And we're not getting that dose. I'm sorry.
Yeah. You know, municipal water has like a certain level of fluoride that they put in like New York City's drinking water. But you know, people who have kids, we're worried about, you know, what is the science that Robert F. Kennedy Jr. is talking about? He's saying, you know, buzzwords like neurotoxin. And, you know, apparently there's new studies that are supporting this neurotoxin that could impact a child's IQ.
I think it's so helpful to break this down because something can be toxic to our bodies at toxic doses. And as an emergency physician, I talk to patients about this all the time. The toxin is in the dose. It's even possible for water itself to be harmful if you take too much of it. And that's the same concept with fluoride. In fact, it shows that there are benefits at lower levels. And this is what I think is so important for patients to understand. The American Dental Association has cited that fluoridated water has been associated with a 25% reduction in tooth decay in children. And our former Surgeon General, Vivek Murthy, has stated that the generation born in the past 70 years, every generation has benefited from fluoridated water. An important reminder, during World War I, World War II, one of the most common reasons to be rejected from the Army was not having 6 opposing teeth. It's really important for people to remember that tooth decay historically is a thing of the past, which is why we call this a public health achievement.
We have well water, so they've recommended, the pediatrician recommended that my children take fluoride tablets because of the importance.
It's been in our drinking water in New York City since 1965, a pretty long time. But there are some communities like Yorktown in Westchester County. Their executive, they cited exactly what you're saying, the study talking about low IQ levels due to fluoride. So how do you, from a professional standpoint, how do we change the conversation about, jumping to these conclusions?
I think whenever you see something that provokes an emotion, regardless of what's the source, especially when it's based in science, your next step should be, let me read the science behind it. Let me understand what is my personal risk. And for the average person, removing fluoride is not going to make that much of a difference. Regular dental cleanings, regular dental visits, but for communities in need where dental health is not always accessible, this will have the biggest effect, which is why I think it's so important to remind people about the benefits.
I love this conversation, and I love it because there's so much junk science. Science is great, people. It's great. It's existed for a long time, and we develop these protocols because they help people. Fluoride in young children helps them to have healthier teeth as their teeth develop. Too much fluoride, a study done outside of this country, where fluoride levels are much higher than your or I am subjected to, that can be a problem. But we need to balance science, and we need to understand when people are crying wolf.
Context,
that's exactly correct.
Context. That's my takeaway from you.
Love it.
And reading is fundamental.
Absolutely.
Dr. Darien Sutton, thank you
Love
for joining
having
us.
you, sir.
Of course.
I like how you threw that in there. All right.